All right, let's get into our first topic then, shall we? Would you be happy to see a nurse instead of a GP? 0207 862 2222 is the number. Get your calls in now. A new report claims England is at a tipping point in the near future where the majority of appointments at a doctor's surgery will no longer be with a doctor. At the moment, GPs are providing about half of all appointments, with nurses overseeing 20% and health workers such as pharmacists providing the rest. So how do you feel about seeing a nurse instead of a doctor if you were booking an appointment? Would you mind? Perhaps you'd actually rather see a nurse for certain things. Or are you booking a GP's appointment because you want to see a GP? I want to know what you think about this. Tell us your experiences. Have you had trouble booking a GP appointment? Yes, I hear the phone lines ringing off the hook at that point. Carole, what do you think? Would you be happy to see a nurse?
Look, don't get me wrong, nurses do great jobs both within GP surgeries and in hospitals. But no, if I think I'm sick, if I think there's something seriously wrong with me and I don't go to a GP unless there is, I would want to see a doctor. You know, the clue is in the name. You know, nurses are meant, the definition of a nurse is to care for the sick and infirm. It's not to diagnose and it's not to treat. And it would terrify me that you have a nurse in charge of, if I went with muscular pain, for instance, they could very easily miss that, think it's muscular pain, and actually it's deep vein thrombosis. If I had a child who was suffering from something like meningitis, a nurse might not know exactly the symptoms to look for. And nor, that's not what they're trained for. They don't have a medical degree. They don't go to medical school. They do a 3-year training course as opposed to 7 years in medical school. So I think this will be delivering. This is not an insult to nurses, but I think it will be delivering third-rate healthcare. If you're sick,
wow.
Well, what do you mean, wow? They're not doctors. They're not trained to diagnose. So if you go with something that I have 2 friends who are GPs, and they spent longer in medical school than they needed to because they understand they're the first port of call for anyone that's got anything wrong, and they understand the responsibility of that. And what it means is you go with something that could look trivial, and actually it's not trivial. But a nurse might not spot that, and she's not trained to. It would not be his or her fault if they didn't spot that, but they're not trained to. I think it's a very bad turn for the health service, and I think literally it's playing Russian roulette with people's lives.
What do you think, Shiv?
So let's look at the facts, shall we? GPs delivered care in half of all appointments. In actuality, what that means, and we know GP workforce has been declining, the number of patients continues to increase, is this isn't a possibility of the future. It's happening right now. You can now go to your local pharmacy if you think you've got an ear infection to see a pharmacist. I, in the past, have gone to, I've not been able to get any GP appointments for 2 weeks, and then I've ended up having to see a paramedic, but guess what? I've got the medication that I've needed. I would love to hark back to the 1990s when I got to see...
It's not a question of harking back.
If I can finish my point, I would love to hark back to the 1990s when I used to go to see Dr. Warnock, my family GP for 20 years. That's no longer the case. You either now are at a point where between 9 a.m. and 4 p.m. you try your best to get an appointment on the day. If you're working night shifts, guess what? You're not going to be able to. And on top of that, you could end up waiting, like myself, up to 6 weeks before you get any type of medical advice. Nurses are qualified. Nurses are qualified, and they're not just going to be sat there looking online. They have gone through as much training as required to see a patient and refer when needed, and refer to a GP when needed.
You just pointed out that you managed to get a paramedic when you were very ill. Do you really think a pensioner is going to be able to do that, to be able to summon the kind of help you were able to? I don't think that's going to happen.
No, I mean a paramedic appointment. You also can have a paramedic appointment. I'm not talking about going to the A&E, just to clarify.
I just think
it's not just nurses, it's paramedics and pharmacists that you can get appointments with as opposed to GPs.
I think doctors are really letting people down. Now, we know that in a lot of practices, the partners work just a 3-day week. If GPs worked a 5-day week, we probably wouldn't have the shortage that we have now. So I think that's a massive problem. And I just think But
how are we going to get them to do that? Because you're not going to get them to do it out of their own goodwill. Well, they already are putting as much as they feel they can.
It's not out of goodwill. It's a dereliction of their duties, because most GPs who are partners in their practice, they're on an average of 153 grand a year. It's not goodwill to do 5 days a week. Doing 5 days a week for 153 grand a year, I think is probably what would be expected.
If we were to look at this in a different angle, I wish we could all be Mary Poppins, where we click our fingers and guess what? More doctors and GPs are going to come flying out from the sky. That's not how it works. Within my own family, I have 2 GPs. My brother is a doctor. And I have to tell you, the conversations that they are now having is about looking elsewhere, either going private or abroad. No one's really having these conversations about retention. Long working hours, and also lack of support. You know, the NHS is built not just with GPs. You have healthcare assistants, nurses, paramedics, and so on and so forth. And what's happening is, if you look at those that are at university, do they want to leave with a medical degree, £100,000 plus in debt? And then guess what? They're not even getting the appreciation or support that they require. Their working conditions are so low when they can actually,
What support are you talking about?
If I just finish my point, when they can actually go abroad and get more training,
Stop this abroad nonsense. When you go abroad to countries like Australia, which a lot of doctors are going to,
exactly, we're losing them.
Well, hold on, it's not a national health service. This country and doctors in this country,
exactly, that's what
Australia
I just said. They want to go private,
which is why they're allowed to be paid more.
But that's why we're seeing doctors working a 3-day week, because they're going into the private healthcare.
So there's a reason
imposing that. You can't force people
imposing that in this country. Doctors wanted it to stay the way it is, but it is because that's why they leave, because they can't get the salaries they can get in private healthcare.
So do we need to pay them more?
No, we need to start introducing a form of private healthcare. They get a lot of money, Storm. Right. Doctors are on a lot of cash.
Let's go to the phone lines and speak to Diana first from London. Would you be happy to see a nurse when you went to your GP appointment?
Yes, hello Storm. Yeah, I just wanted to say my son went to university up north. This was a couple of years ago. When he was ill, whilst he was there, because obviously I was at home in London, so he went to see the GP, which he's allowed to do based on the university. When he got there, he didn't get to see the GP. He actually saw what was called a super nurse. Now, all of a sudden, this super nurse didn't...
Did she have a cape, or he have a cape?
No, apparently they're called super nurses. And so she asked him, how are you feeling? He said he wasn't feeling well, his chest was tight. She did not do anything to him. She didn't check his chair. She didn't do any, what they usually do, checks and whatever, look in his ear and stuff, see if his ears are swollen, throat swollen, nothing. She just said, oh, you're fine, go home, take a Lemsip, go back to bed, you'll be fine, don't worry. So off he went, so with his young self. So he went home, went off to bed. 3 weeks down the road, he's still ill, but this time he is really bad. By the 3rd week, he's not moving out of the bed, he's not ate any food, didn't go to university, didn't go to his classes. His actual buddy who lives next door to him, the room next door, she called me. And she told me he hasn't been to class for 4 days, he hasn't moved out of the bed, hasn't ate any food, he's got a really high temperature, and he's really not looking good at all.
Okay,
so I said, okay, fine. So as a super mum, I jumped in the car, went down there, took him some food, took him some water, then got him in the car, take him to the A&E, got him to the A&E, and they told me he's got a chest infection, he's not well, and basically that chest infection was now going to get worse. He would have probably ended up in hospital after 3 weeks of letting it.
So from that story, Diana, I'm going to summarise, you would not be happy to see a nurse instead of a doctor?
Well, listen, if we go to the supermarket and we buy a tin of beans, we open it and we get a tin of beans. We don't open it and get a tin of spaghetti, right? It says what it says on the tin. You're either a doctor or you're either a nurse.
Okay, but it's whether we think nurses can fulfil that duty when it comes to the medical profession. Diana, thank you very much for calling up and sharing your experience. It would be lovely to speak to a nurse. I believe we have one. Angela from West Yorkshire, are you a nurse or were a nurse?
Yes, I am, yeah. I'm a specialist stroke nurse, actually. So I'm ringing really because I was quite taken aback by what Carole said in terms of that we're not trained to treat and diagnose, which is not true. We're highly trained specialist practitioners who, many of us are master degree trained.
Yep.
In our specialist area.
There we go.
No, hang on a sec. I just want to ask you, Angela, how many nurses do you think have degrees, medical degrees?
Oh, thousands and thousands now.
I would disagree with that.
No, you're wrong. And advanced nurse practitioners and emergency nurse practitioners, specialist nurses like myself, are highly trained.
You wouldn't work in, can we talk about,
undiagnosed.
we're talking about nurses and GP surgeries, not in hospital, in emergency units. I don't imagine that I see the nurses in my surgery and they are not trained in the way you are. You're a specialist nurse. That's different.
They are advanced nurse practitioners that work in GP surgeries.
Angela, can I ask a question? What percent, because I read about advanced nurses and you do get additional training to help you deal with diagnosis and that sort of thing. What percentage of the nurse population, if you like, would be advanced nurses if you had to guess?
Oh gosh, more and more and more now, because most of us also prescribe as well.
Are we talking 10%, 5%, 1%?
Oh no, many more than that.
Can I interject? Because Angela, I think what you're saying is so vitally important. If I was booking an appointment with my GP, if I was told that I'm going to be getting an appointment with a nurse, I can quite clearly ask, is this an advanced nurse practitioner, as you have already stated? And I can say, no, I don't want to see that nurse. No GP, I think, would ever want to put any patient's life at risk. So before any of these advanced nurse practitioners are even allowed into the GP services, they will have gone through all of the training. That's the point you're trying to make.
Yes, absolutely.
Yeah,
do you both imagine that most people would know to ask if it was an advanced nurse? They would not.
Okay, Angela.
I think that's the issue. I think people need to know, and I think people need to understand the role better, and that needs to be more publicly put out there. Obviously, so from my point of view, I work in an A&E department. I'm an acute stroke specialist nurse. The first person that a patient who comes in with a stroke sees is me. Yep. It's not a doctor. It's me that treats and assesses and makes a plan of care for that patient. And that is becoming more and more the norm as we're losing more and more doctors. And nurses are not just there now to hold hands.
Angela, I suppose the point that Carole is making is that though it's becoming more and more the norm, does it mean that we're getting the same standard of care as we would if we'd seen a doctor first?
You are, because at the end of the day, there's not a nurse in the country who's an AMP, an EMP, a specialist nurse, that would want to do anything that would cause harm to a patient.
No one is saying that, Angela. No one is saying you know, you guys do an incredible job. I'm not saying that. What I'm saying is, if it's a condition that you're not trained to spot, you are trained in strokes and you know exactly what that's about. If it's something else like sepsis, like a DVT, whatever, some nurses, the majority of nurses, I think, would not be trained to spot that.
Of course we are. We are absolutely trained to spot things like sepsis, DVTs.
Why do so many people die every year with sepsis and it goes unnoticed?
Well, that's doctors that are maybe missing that as well.
So nurses are getting it, doctors are
Angela, thank you very much for your call. I'm conscious we've got lots and lots of calls on the line. Joanne from Surrey, what's your thoughts on going to see a nurse instead of a GP?
Are you asking me?
Yes.
Oh, well, back in 2016, my husband had severe urinary tract infection, wound up with sepsis in hospital. When he was released, he was told to make a routine doctor's appointment the following month. When we went to see the doctor, it wasn't a doctor, it was a nurse practitioner. She said, how are you feeling? He said, oh, I'm fine. She said, all right, fine, make another routine appointment for the following month. The following month, we did ask to see a doctor. Again, we were shown to see a nurse practitioner. She said to him, how are you feeling? He said, oh, fine. She said, fine, make another appointment with a doctor for the following month.
Tests? There was
no taking
blood
we tried
pressure or...
Sorry?
Anything? There was no other test? She didn't take his blood pressure?
Oh, no, she didn't do anything. She just said, how are you feeling?
Right.
When we had the third appointment, I insisted that he see a doctor. The receptionist at the surgery tried to talk us out of it, saying, oh, the practice nurses know everything. They're okay. And I said he would like to see a doctor. Mm-hmm. He did see a doctor. The doctor said, this is very unusual that you should have a urinary tract infection and have sepsis. Let me do an internal. He did an internal examination. He found something. My husband was sent for diagnosis, and he was diagnosed with prostate cancer.
Oh.
Had he not seen a doctor, I don't know where we would be at this point.
That's exactly what that I'm talking about, that nurses would not be trained to spot that. And the nurse did not. And not everyone would be like Joanne and insist on seeing a doctor.
But I suppose the question is, are we, because we've heard of 2 situations that were incredibly sad, but are they just exceptions? And actually,
you've had 2 callers on it,
nurses
and both have said they had terrible experiences.
And yet, the part of the issue that we haven't discussed is how do we get GPs to stay when we are losing them without the support, including having these nurse practitioners there to take on the appointments, such as a minor infection or a cold sore. That's the other aspect.
Okay, Joanne, thank you very much for calling and sharing your experience with us. So many people are getting in touch and calling us on this that we're going to take some more calls after the break. There's plenty of time to share your stories, so do give us a call. Would you be happy to see a nurse instead of a GP? 0207 862 2222 is the number we'll see after this. In a moment, we'll be discussing whether Labour are handing out too many pay rises. We've had doctors getting a 22% pay rise, train drivers being given more money, and now train guards are reportedly getting a 15% increase. Is that fair? What do you think? 0207 862 2222 is the number for your views on anything we're covering today. But let's get straight back now to your calls on whether you would be happy to see a nurse instead of a GP. Let's go to Joe in London. Would you be happy to see a nurse?
100%, yes, definitely.
Even though we've heard 2 stories already this morning of nurses not doing any checks, just seeing how the person felt and missing key things?
Well, it does depend on the experience of the nurse, but it also depends on the experience of GPs as well. In my case, I went to my GP 5 months ago with a swollen left leg. They diagnosed, with my help, cellulitis. It presented as cellulitis.
Okay.
I was given antibiotics. It went down somewhat, but not down completely. And within sort of 8 weeks, I was feeling breathless, and I was struggling to get to and from work. I then presented myself to A&E after speaking to 111, and the moment I walked in to see the triage nurse, she put me on oxygen. And she said, you've got a DVT, I'm going to get an X-ray of your lungs. Wow. And I've now got 2 large clots on my lungs.
So
this is no fault to my GP and no fault to anyone in medical profession. I had Googled symptoms for a long time before I went myself. I'm just saying that it depends on the actual experience of the actual nurse and the doctor. The doctor said to me, if it doesn't go down, go to A&E.
Okay, Joe.
But the nurse, the moment the nurse saw me, she knew exactly what it was.
But it might have been missed by another nurse, and it could have been spotted by another doctor. So you think it's the experience? That's interesting, Joe. Thank you so much for your call. Gillian from East Sussex, how would you feel seeing a nurse?
Well, as a retired nursing sister, an A&E nursing sister, I would not be averse to seeing a nurse at any time.
For anything?
They are highly skilled. I'd like to point out to Carole that the nurses today do a 4-year degree course
to
qualify as a nurse. It is not they're not the old SRNs.
Yeah, but they don't go to medical school. Julia, they don't go to medical school.
I know, but I'll also point out that I would like to say that my sister went to her GP. My sister went to her GP. She went to her GP complaining of breathlessness without putting a stethoscope on her chest or doing a peak flow check. Asthma. Gave her treatment, sent her away. A few days later, her breathing was worse. Went to see a second GP. Same thing happened. Asthma, no stethoscope, no peak flow, nothing. Go away. Later in the week, she went again. More breathless. A third doctor. No checks. Asthma, go away. She collapsed the next day, was rushed into Brighton Hospital with a pulmonary embolism. The pulmonary embolism had broken up and spread all the way through her lungs, and she then had to wait through COVID because all the intensive care beds were taken up before she could have major surgery of Papworth to remove all these clots that had gone into her lungs so that she could live a normal life. And she went to Papworth and had her whole chest had to be opened up to remove these clots because three GPs didn't bother to check her properly.
I am so sorry.
A nurse would never have done that. A nurse would not. They would have done a peak flow on them, and they would not have missed this.
Gillian, thank you very much for your call and explaining that. It appears that things are being missed by doctors and nurses alike.